I want to talk to you guys about a 78-year-old guy who showed up at my practice and he had 4 implants placed at the university and he didn't have any teeth on those implants. It was an all-on-4 design. Now, he had already undergone bone grafting when this implant was placed. The university which did the implants didn't want to go ahead with the prosthetics unless he got additional implants, probably zygomatic or something of that nature. Now, the patient didn't want to go through any other surgery. He came to us looking for a solution. So if you take a look here, this is our implant in question in the 1-1 location, and you can see there's quite a lot of bone loss. This is more than 50% bone loss happening on the buccal side. And if you take a look at the implant in 2-1, that's not too bad. We have good amount of bone over here. Clinically, when we look at it, there's probably about 2 or 3 threads showing, but it's not too bad on the CBCT. The angulated implants were fine. Plan here is, in this location, the plan is to remove this implant and use this little bit of bone in the back here to get some anchorage and get a stable implant in. So when we place that implant, you can see that's kind of approximately where we're going to be placing that implant. So what was the plan getting into it? The plan was firstly that we wanted to remove this implant as atraumatically as possible because we didn't want to damage any bone. If we used a trephine, we would have ended up destroying a lot of bone and reduced our chances of placing an implant at the same time. So instead, fortunately, Neobiotech was very kind to send over their implant removal kit for this particular treatment. And what we ended up doing was using this kit to engage the implant, reverse torque the implant out, and the whole thing came out in 5 seconds, and I was able to place the new implant in that same location without any issues whatsoever. Now let's look at the CBCT after the procedure. So as you can see over here, our new implant is in place. It's completely encased in bone. It's nice and stable. We have placed a multi-unit on top of it, and now it's time to fabricate his temporary prosthesis. So we went ahead and did exactly that. We were able to give him a temporary prosthesis. He was able to have his smile back. He was able to have his function back. If you look closely at these pictures, his PFM bridge on the mandible is not ideal. It's very bulky. It's very thick. There's recession. They need to be changed, but we'll handle that in the final. As of now, we're just happy to give him functionality back. He's happy to be smiling and chewing again. And I hope this whole experience has taught you that sometimes you don't need really very radical solutions to render treatments for patients. Sometimes you just need the right tools to do things as minimally invasive as possible. I hope this confuses you enough. This is the Dental Review Guy signing off with a smile.